you have a pinched nerve and you're considering an MRI, there are definitely some things that you want to know. And I want to go over the top 3 things that just blow my patients' minds when we're talking about MRIs, lower back pain, and getting those for a pinched nerve. I know you haven't heard these before. Stick with me. We're going to go over those 3 things and what you should do instead. So my name is Dr. Michael Derry. I'm a concierge physical therapist here in Jacksonville, Florida. And oftentimes I treat clients with pinched nerves. And when they have a pinched nerve, they want to have an MRI. And when we go through that thought process, we want to make sure that MRI is appropriate and going to change the pathway of care. So the first thing that I tell them to consider is that when you go to your doctor, let's say you go to an orthopedic clinic and you want to receive an MRI, they may be giving you that MRI because they own the machines. They own the MRI machines. So they make more money the more MRIs they do. We want to know that, and intuitively that makes sense, but we want to think that the doctor is going to have our best interests in mind. But remember, they're trying to make you happy and that they own the MRI machine, so it's low-hanging fruit for them to do the MRI, but I've seen this many, many times. They do it and it may not be necessary, and if we look at the literature, the research and the literature agrees that you're more likely to receive an MRI if the physician owns the MRI machines. We talked about if the physician owns the MRI machine, you're more likely to have an MRI. That kind of makes sense. The other thing you want to consider is this paradigm. And so when you go to your doctor and you're wanting to be treated for a pinched nerve, most people don't want to have invasive procedures done, like an injection or surgery, but they're craving that MRI. They want the MRI to solve their problems. Well, what we know and what we see in the research is that if you have the MRI, you're actually more likely to receive invasive care than conservative care. So invasive care could be medication, it could be surgeries, and it can be injections. And those are the things intuitively we don't want. We don't want to have those things because we know of people that haven't had a great path when they go down that those different treatments. And so if you're wanting more conservative care, especially if you want to stay active and not have the risk of those more invasive measures, then you want to lean away from getting that MRI early for your pinched nerve. And then we're going to go over the third reason, or the third thing that's going to blow your mind and why you should not receive that MRI right away. So this third reason is my personal favorite, and this is really frustrating for me, is when I have patients who get an MRI, this is what happens. And so they go get the MRI, then the MRI is uploaded to their portal and they jump right on and they see what's going on. Well, the MRI impression or the results are written in a way that you can't even understand. It takes like a 10th grade education on average to understand it. Then there's a lot of terms on there that you have to Google, and then Google kind of tells you that it's doom and gloom and then future isn't going to look good. And so what really frustrates me is the MRI doesn't come with a proper education. And so the physician or whoever ordered it isn't sitting down with you and explaining every term on there and how it relates to you. And that's what a physical therapist does, is that we look at that impression, we look at what's going on with your spine, we see how you're moving. And it just really, really frustrates me is when physicians or whoever orders the MRI doesn't do the proper education around it. And so you can still feel just as lost as you were before you had the MRI after you receive it. So really try to take that in consideration if you're wanting and feeling like you need that MRI for your pinched nerve. The MRI results may not tell the story, they're hard to understand, and may not even apply to your actual pain in that moment. And that's just what I've seen over time from treating clients. And so now we know those 3 things. We're gonna move on to what I would do if I were you and in your shoes, and what I've seen patients have success with. We just went over 3 things that I know you haven't considered before when you're getting an MRI for a pinched nerve. Now let's go over what a pinched nerve actually is. And so a pinched nerve is a misnomer. Your nerve isn't actually being pinched. Typically there's inflammation around the nerve, and that's caused from disc bulges or herniations or some sort of stenosis and just a narrowing around the nerve, or it may be caused from a piriformis muscle, and that it's just too hypertrophied and putting pressure on the nerve. We don't really know, and most of the time it really doesn't change your treatment. So we don't really spend a ton of time trying to diagnose it like that. What we do want to know is, are you having nerve-related symptoms that warrant an MRI? And so if you're having nerve symptoms such as numbness and tingling, burning down the leg, changes in your reflexes and myotomes and strength, different things like that can be monitored from a physical therapist or a health professional, then they can kind of guide you in the right direction and see if an MRI is really warranted. If you're not having those things, then I wouldn't really go searching for the MRI. What I would do, and what I see people have success with, is teaming up with a movement professional to help them move better. Because if you're in that situation where you're having a pinched nerve, it's most of the time when you move that you feel awful. So team up with a movement expert, such as a physical therapist, and that we get you moving better, feeling better, and we monitor those symptoms along the way to see if you really need that MRI or a more invasive measure. And when we bring those two things together, we not only match the evidence, but your outcomes are way, way better. And so team up with that physical therapist. They're gonna help you along the way. And that is what the best evidence shows. And I know your pathway is gonna be much more enjoyable and your experience is gonna be much better. And if you want to know some exercises to help you with that pinched nerve, look at my past video when I go over a great amount of stretches and exercises to help you with those pinched nerve symptoms. I'm gonna put them over here or somewhere on the screen that you can reference. They're a great reference for you to just learn your body, learn what the exercise should feel like, and start improving your signs and symptoms such as the tingling or pain down your leg safely and effectively. But today I had a great time addressing 3 things that I know people don't consider, what a pinched nerve actually is, and some exercises or resources you could use to help you feel better. If you guys have any questions or comments, please reach out, put them below the description so we can kind of engage and make sure you're on the right path of recovery. But as always, guys, stay healthy, keep moving, and take care of yourself.